Hello and welcome to the types of pain video in the pain management masterclass. In this video, we're going to cover nociceptive pain, which is pain coming from damaged tissues, neuropathic pain, pain coming from the nervous system and nerves, the difference between acute and chronic pain. We'll talk about referred pain, pain coming from somewhere that is not the source of pain. And visceral pain, pain coming from an organ that you might feel elsewhere. As always, follow my YouTube, Instagram, and TikTok channels for exclusive content. And don't forget to share the course. Let's start a revolution and change people's lives together. Caution, this is the most important video in the entire course. Watch the entire video. Don't skip. Don't fast forward. Pro tip, watch the video in 2 times speed to get through this information a little bit quicker. So first we have nociceptive pain, which originates from damaged tissue or injury and is communicated by nociceptors, which are specialized nerve endings that detect harmful stimuli. For instance, lifting a heavy weight overhead and hurting your shoulder. This is the pain we're all familiar with. It's the pain that you get when you bang your toe against the corner of a couch and your toe gets a little bit swelled up and inflamed. These nociceptors are distributed throughout the body and relay pain messages in response to various stimuli like heat, pressure, or chemicals released by the injured tissue. These cells, what they'll do is they will alert the rest of your body and your brain that something happened which was not good or potentially not good. And then your body will respond and maybe send cells over there to help fix up some of the damaged tissue or to eat up some of the tissue that has already died. Nociceptive pain commonly stems from acute injuries, surgical wounds, or inflammatory conditions like arthritis, typically exhibiting localized and time-related symptoms. So this is like when you hit your toe against the corner of a couch, only your toe is going to hurt. It's not like you're going to get pain in your low back by hitting your toe. And over time, that pain will first be very intense and hurt a lot, and then it will get less and less intense over time. Nociceptive pain is categorized by its location, which is specific, the intensity and quality of the pain, which is often described as sharp, throbbing, or aching sensations localized to the injury site. Despite being uncomfortable, nociceptive pain serves a crucial protective function by prompting individuals to take protective measures and alerting them to potential threats to their health and safety. As soon as you hit your toe against that couch, you are not going to do anything that puts you in a similar situation where you may do that again. That's one of the good roles of pain, is it tells you when that pain is simple and you know what caused that pain. It tells you how to not make that pain worse. Don't hit your toe against the couch again. Don't do anything where you're putting a lot of pressure on that toe. Don't move your toe to the extremes right now because it's very inflamed and it's painful. But over time, we want to listen to our body again. That toe isn't going to take a long time to heal. And once it does heal, we want to start moving it slowly and consistently, constantly communicating with our nervous system, seeing what it's okay with. Then we have neuropathic pain, which arises from damage or dysfunction of the nervous system, causing abnormal sensations like burning, shooting, or electric shock-like feelings. I'm sure most people have experienced this before when they hit their elbow on the corner of their chair and they get that shooting pain right down the arm. Neuropathic pain can result from nerve damage, nerve compression, like when you hit your elbow against the corner of or the armchair, or dysfunction disrupting normal nerve signaling and leading to persistent discomfort. Neuropathic pain is commonly linked with conditions like diabetic neuropathy or cervical or lumbar radiculopathy, each presenting with unique challenges in pain management. However, nerves love three things. They love to move, they love space, and they love blood. I'll go in greater detail in future videos on how we can move nerves in a way that is comfortable and decrease the intensity of symptoms when these nerves are irritated. So very commonly with a cervical radiculopathy, there's compression of that nerve where the nerve comes out of the spinal cord at the nerve root. In other words, there's just a decreased amount of space that nerve has. It's almost like if you have a garden hose and you look at your muscles as the flowers and the hose as the nerves. It's like there's a little kink in that hose, and now that water isn't flowing as well to those muscles. And what we want to do is we want to create space. We want to move those nerves in a way that allows for more transport of ions and fluids across the nerve so it's more effective, or we want to allow more blood to get to the area of the nerve, and we do that through exercise. So given its chronic and unspecific nature, neuropathic pain can significantly diminish quality of life, affecting daily functioning, sleep, and emotional well-being, highlighting the importance of targeted treatment approaches specific to the pain origin and the nerve which is irritated. So, as I talked about in the previous video, we have those dermatomal levels where you can sort of take an educated guess about which nerve is being irritated. And then when I show you guys the nerve flosses and nerve collides, we'll be able to target those nerves as specifically as we can. Next, we'll talk about the comparison between acute and chronic pain. So acute pain typically arises suddenly from injuries, surgeries, or infections, while chronic pain persists beyond the expected healing time, enduring it for months or even years. Acute pain is very commonly nociceptive pain. It's from injuries, surgeries, or infections. Neuropathic pain could also be acute, but it's more often going to develop into chronic pain because it takes longer to manage a neuropathic pain pattern than it does to manage a nociceptive pain pattern, and often those two intertwine as well. Some common triggers of acute pain include sudden injuries, postoperative discomfort, and acute illness, and they're often accompanied by specific tissue damage or inflammation. So acute pain could transition to chronic pain if there's inadequate treatment, psychological stressors, or underlying health issues leading to prolonged discomfort and impairment. Chronic pain significantly impacts physical function, emotional well-being, and social interactions, leading to reduced mobility, increased stress, and strained relationships, necessitating a comprehensive approach to understand and manage your pain. So the goal is, if you are in acute pain, we want to manage that pain as quickly and as optimally as possible so it does not turn into chronic pain. We'll talk about chronic pain more in the next video, but chronic pain could last a long time. And a lot of the times it only persists that long because it was effectively managed in the first place. So here's a little chart about chronic pain and how it develops over time. So this blue line, we have the normal tissue. In the beginning, it gets hurt, so that tissue is injured. And over time, it heals all by itself because our body is one amazing thing. This red line over here is your perceived pain. In the beginning, since that tissue is damaged, that nociceptive pain is going to increase. It's protective, It's protective, and it is there to protect you. Over time, as that tissue heals, you may begin to feel a little bit better and have good days and bad days. If you manage it correctly, this pain will go down to zero once that tissue is healed. If you manage it ineffectively, then your nervous system still thinks that there is a problem wrong. So what it does is it heightens that alarm system, and it says, no, you remember you hit your knee is hurt, your knee is harmed. Let me remind you that so you don't do anything too crazy for your knee. And then that pain persists and gets bigger and bigger over time. All right, then we'll talk about referred pain. Referred pain patterns are sensations felt in areas distant from the actual pain source. This is due to shared neural pathways between different body regions. It's the same example as with that herniated disc, where you're feeling the pain in your arm, but it's actually coming from your neck. This happens because referred pain occurs due to overlapping nerve pathways, where sensory signals from one region may travel along nerves serving other areas, leading to pain perception elsewhere. For example, pain originating from your neck that you feel in your shoulder or your arm. There are different patterns of referred pain. We'll go over a few of them. There's a dermatomal referral, which involves pain sensations following specific nerve roots emerging from the spinal cord, like radiating arm pain due to compression of cervical nerves. You can see this here if we get out of this presentation and we look at, say someone has a neck pain and a herniation of their C5, C6 intervertebral disc, which is compressing on that C6 nerve. We're going to get pain going down the arm, and it could even go into your thumb. It could only affect one level, like that C6 dermatomal pattern, but it could overshed into the C7 nerve pattern or go up into the C5 nerve pattern as well. I also included another image just so you can see how these dermatomes kind of make sense and they're not as challenging to understand. Is if you are on all fours and you just draw a line down from your spinal level, you'll be able to see how those dermatomal patterns really came to existence and formed. There are also sclerotomal referral patterns, which manifest as pain in a specific pattern linked to joint structures, such as discomfort in the shoulder blade region originating from the lower cervical joints. And I'll show you an image about the sclerotomal patterns. I'll also show you images about muscular referral patterns, which manifest as pain in a specific pattern linked to a muscle, such as pain in your lower back originating from your hip abductors. This is so important because we have to make the unknown known. Accurate differentiation between pain source and referral site is crucial for pain management and overcoming the source of pain. So here we have those sclerotomal patterns. If you ever had like a knot right in between your shoulder blade over here, it's about 80% of the time coming from your cervical spine. What happens is you start feeling pain in this area, and then you don't move your shoulder as much, because whenever you move your shoulder, you may feel a little bit of discomfort because this area of your skin is now sensitized. But to get rid of this pain, we have to treat the neck. We have to move the neck in ways that it may not have been moved in a long time, because moving it in that way causes pain, and do that slowly right on the line between comfort and discomfort. Here's another example of some sclerotomal patterns of the low back and how that pain could refer to the inside of your leg or the outside of your thigh. And here we have some muscle referral patterns. This is of your infraspinatus, which is one of your rotator cuff muscles. And those X's denote the trigger points or approximate trigger point locations. And the red refers to where you feel the pain. And you see how you can have a pain right in your, or you can have an impairment in your shoulder and feel pain right in the front of your shoulder or going down your arm, even into your hand. This can also happen for a lot of people. They have pain right in their low back, and it's right at those two little hard bumps in their low back, and they're convinced it's their low back causing their pain, when in actuality it's some sort of muscular dysfunction of their glute medius in this case. And lastly, we'll talk about visceral pain. Visceral pain originates from internal organs, often arising from conditions affecting the gastrointestinal tract, reproductive organs, or other viscera. Organs like the gallbladder or reproductive organs transmit pain signals through visceral sensory pathways, leading to sensations of deep, diffuse, or cramping discomfort. These visceral sensory pathways converge with other sensory pathways in the nervous system, referring pain to locations distant from the dysfunctional organ. Due to its diffuse nature and referral patterns, diagnosing visceral pain can be challenging and requiring careful consideration of symptoms, medical history, and diagnostic tests. For example, individuals with cholecystitis may have pain where their gallbladder is located in their right upper quadrant of their abdomen. They may also present with right-sided shoulder and upper back pain. So I recently had a patient tell me about one of her friends who went to her primary care physician with right shoulder pain and then was referred to a chiropractor. And the chiropractor was treating her for about 6 to 8 weeks, and her shoulder pain was not improving at all. But he wasn't taking into account the other symptoms. She was feeling like nausea and cramping in her right upper quadrant. And it was only till after 8 weeks where she got the treatment where she needed. But there were still some other impairments of her shoulder because she had that shoulder pain for so long, so she wasn't moving it around the way that she normally did. So once her gallbladder was treated, then after that, she focused on her shoulder impairments that arose from the pain and not moving as much. So visceral pain can be associated with various conditions like gastritis, gallbladder disease, or endometriosis, each categorized by unique pain patterns along with other symptoms. Another good example of a visceral pain referral pattern is someone who's having a heart attack and they get pain shooting through their chest, upper left shoulder, and going down their arm. This just happens because those sensory nerves share the same pathway as other nerves that innervate those areas on their shoulder, arm, and chest. So effective management of visceral pain involves addressing the underlying condition along with symptom management methods tailored to your needs, often requiring a multidisciplinary approach for optimal outcomes. So, like that example with the patient with gallbladder disease, she was treated by her GI doctor as well as the chiropractor to optimize the outcomes and treat both the source of pain and then some of the impairments that arose from not using the shoulder as much. So here are some examples of some visceral referral patterns. We talked about that heart going into the left chest, shoulder, and then down the arm. We talked about the we talked about the gallbladder, where you might have that right upper quadrant discomfort as well as that right-sided neck or upper back pain. All right, so let's get into a summary. In this video, we talked about different types of pain. We talked about nociceptive pain and neuropathic pain and how they both can sort of overlap on each other. We also talked about the difference between acute and chronic pain, and acute pain is very specific and it follows a time duration, while chronic pain is pain that extends beyond the expected healing time of those injured tissues. Then we also talked about referred pain. We talked about joint referred pain, nerve referred pain, muscle referred pain, and visceral referred pain. Please leave a testimonial at testimonial.to/pain-free pathfinders to win special prizes like free ebooks and free weeks of the course. And for today's quote, it's by Eckhart Tolle. It's to know yourself as being underneath the thinker, the stillness underneath the mental noise, the love and joy underneath the pain is freedom, salvation, and enlightenment. I like this quote because it really just talks about the duality of perception. You can either view yourself as pain and let that pain sort of control you, or you can look at yourself as the love and joy that you get in understanding yourself and finding meaning in your pain, and that supersedes that pain, and you can identify and perceive that in place of pain. All right, so thank you for your time, and let's get to work.